Space. Last month we brought you power chairs. These are Tilted Space chairs, so a little bit less complicated than the power chairs, but still have a lot of pieces and parts. So hopefully you guys have seen these. Again, the big issue is that they're all very different. So we brought some that have some different characteristics to show you. Big takeaway is if you don't know how to use it, ask somebody. So just let us know. But I'll show you this one first. So this one has elevating leg rests, and then it has, the brakes are down here. So these are just standard wheelchair brakes, which are uncommon on Tilted Space, but we have those. So those ones are easy because they're exactly the same as just a standard chair. The tilt on this one is in the back, so I'll turn it, and it's just a trigger. So you always want to make sure that you have the chair locked before you tilt it, but this one just tilts back and forward with the handle. Then this one with the elevating leg rests, they can come up and down if our patients need that. Up is always easy because you're just going to lift. And then there's always going to be some sort of trigger or handle to lower it back down. So on this one, it's just that, to lower it back down to normal. You always want to try to avoid elevating if you can, because it makes the whole chair longer, especially when you're trying to turn into rooms. And if you have it tilted and the legs out, you've got almost like a bed that you're trying to turn into rooms. So if you can avoid it, try to. And then this one, if you guys were here last month for the power chair, the headrest comes off the same way. So you just have a turn off, turn it to loosen, and then you can pull it out. And that you want to do for getting them in and out of the chair if you're using a Hoyer lift. The other thing is you want to tilt the chair back if you're doing a Hoyer lift to help get their hips back, same as with the power chair.
This chair is just slightly different. It just has regular footrests that do the same as just manual chairs, so you're just gonna click and pull. I believe these even might rotate in. This braking and tilting system is all on the back. This is the most common tilt and space chair that we have. So the brake is this bottom one, just straight down. And then once it's braked, then you're tilting up. Sometimes with these, if a patient's in it, the down's gonna be easy. Going up, or to get it started going down, sometimes you have to lift up to engage it, and then it'll go down. A patient's body weight's in it. This headrest is the same thing. There's a lever right here, and it just pulls right out. These are probably the most common pages and calls I get on tilt and space wheelchairs. The patients that are in tilt and space wheelchairs have funky headrest setups because usually they aren't sitting properly. So just make sure to remove them when you're transferring them, because the bolts are getting stripped and loose because we're just cranking them out of the way, or the splint or the sling's cranking them out of the way.
Yeah. The big thing too that I like to remind people, like tilt and spaces are really for a very small population. You're not going to see a lot of them because they are big, bulky. So mostly for our DOC patients. I've had people that get them while they're here, and they're like, if they're standing up and walking, there's no reason they should have this big, huge piece of equipment. If their butt is hurting so much that they need to tilt back, they should just stand up and get in bed. This is really for our patients that cannot tell you when they're hurting. You're just tilting them when you notice they're in pain, those types of things. It's not for, that's why we don't have very many downstairs and you don't see them up on the floor a whole lot, except for with our DOC patients. I feel like that's the most appropriate. Like with our spinal cord patients that are able to use a power chair, they don't need this. They might start with something like this, but the eventual goal being to get to a power chair. So these are very few and far between that we're using. Oh yeah, we should talk about the handles. So the push handles, almost I think all of ours have the height adjustment, so you can push the knob and bring it up and down. So when you do have them tilted, you don't have to be leaning down, hurting your back to move them up and down.
And I think the only other part, which I feel like you're usually not doing regular transfers in this chair, would just be the armrest. So this one has a flip back armrest this one has a button that just completely removes.
But they're all going to be different, so if you can't figure it out, let us know. Don't just yank and pull on it till it breaks, because they will. Does anyone have any questions about the tilt and space chair? Anything